Well, for more on the impact the pandemic is having on childbirth and the healthcare industry, let's talk to Rajeev Dehejia. Rajeev is a professor of economics and public policy at New York University's Wagner School of Public Policy. Thank you for joining me.
Good evening. It's a pleasure to be here.
So talk about some of the trends that you're noticing in terms of birth rates during COVID.
So it turns out that we've known for more than a century that recessions, times of economic hardship, there are just less babies that are born. So this is a very, very long-standing pattern. If you can go back to the Great Recession, you can go back more than a century and see exactly the same pattern. Roughly speaking, there's something like a 1-for-1 relationship. If there's a 1 percentage point increase in unemployment, we expect something like a 1 to 1.5% decrease in birth rate. So now you plug that into the Great Recession, unemployment has increased maybe by 10%. Gives you a sense that birth rates are really sharply declining during this period of COVID, perhaps as much as 10 or even 15% during this time period.
So then what sort of impact will these sorts of trends have on economies if that continues?
So what we need to distinguish is short run versus long run. In the short run, what's going to happen? There are going to be fewer babies born. So in some ways, that actually might end up being a boost for the economy because the mothers, some of whom would have exited the labor force, perhaps temporarily, perhaps in the medium run in order to look after the children, those mothers are going to stay in the labor force. So that's on the plus side. On the minus side, of course, the baby industry is a big part of the economy. Hospital care, all the other products and investments that you make in children, so all of that's going to take a hit. But the birth rate will bounce back as the economy bounces back, and so we think these effects are transitory. However, when you look in the long run, it does mean that there is a cohort of children that just wasn't born because there were tough times in the economy. So if you look forward 20 or 25 years, that's when you expect to see this baby dip working its way through the economy. There'll be fewer children in schools in certain years or cohorts. There'll be fewer workers in the economy in certain cohorts. But those effects, we're going to see them 2 decades or more from the present.
So we're also seeing now then a greater interest in midwifery training. So talk about some of the pros and cons of that.
So this is a very interesting phenomenon. Some of this is economic and some of it is cultural. Economically, health systems do save a lot of money potentially by having home-based births, for example. Hospitals are very expensive places to give birth. But at the same time, the reason that we've moved to hospital-based births is that birth outcomes tend to be better. So there actually have been a number of studies that have looked at this, and the data does support the view that it is really safer to have a birth in the hospital. So why are we seeing this trend? Part of it is, of course, COVID-specific. People are afraid of being in hospitals. That's very specific to this time period. But I think there also is a cultural shift that has moved us toward home-based births. People want to give birth in an environment that is more comfortable, more familiar, less stressful. And so that trend is something that we do observe in the data as well. But it is worth noting that home-based births are still a relatively small fraction of the total births that occur. And so while the trend is real, it's important not to overstate its impact on the big picture.
So then for prospective parents and new parents who are sort of wondering what they should do in this current situation, what sort of questions are helpful to ask when trying to make a birth plan under such circumstances?
It's an excellent question. So, going back to the data, one of the things that we observe about birth rates, as we said, birth rates go down in recessions, but we do also observe that the babies that are born in difficult times, perhaps paradoxically or surprisingly, tend to be healthier. Why is that? Because the parents who are able to give birth feel confident to have a baby during recession. They tend to be better prepared. And so you can sort of take some practical guidance from that as a prospective parent. How ready are you to look after a child during a time of economic uncertainty? If your job is certain, if you're certain of your employment and your salary, either both parents or at least one of them, then that should tell you that in fact this may not be the worst possible time to have a baby. On the other hand, if the economic uncertainty is very real in the work that you do, if you're at risk of losing your job, your income could go down, if you potentially face disruptions, that is probably a sign that this isn't the best time for you to consider having a child. Wait a little bit. So it depends a little bit on the age of the parents as well. When we talk about a missing cohort of babies, we need to remember that as times improve, some of the people who didn't have births this year may just have been postponing them. You can wait, and in a couple of years, some of those parents who chose not, prospective parents who chose not to have kids this year, they might try again a year or two from now.
All right, thank you so much. Rajeev Dehejia there, Professor of Economics and Public Policy at NYU Wagner.